that we're going to have a conversation about ways in which we deal with this pandemic, because I want to be absolutely clear with you. I don't believe we can keep going indefinitely with non-pharmaceutical interventions. I mean restrictions on people's way of life, just because a substantial proportion of the population still, sadly, has not got vaccinated. And I think we're going to need to have a national conversation about the way forward.
I've got no interest in mandatory vaccination, apart from the high-risk settings in the NHS and social care, which we've already set out that we will legislate for. Other than that, if you talk about universal mandatory vaccination, I think ethically it's wrong, but also at a very practical level, it just wouldn't work. You know, getting vaccinated has to be a positive decision.
Is it the case that, come January, we could be looking at even more significant measures being brought in?
No, I hope not. I mean, I think the action we've taken now is very decisive. I think it's going to make a big difference. And as I say, it's not something that anyone would do lightly. It has a real impact on people. It will be difficult for many people. But I think that, and I hope most people would understand, it's better to take this action now than to see the rate of spread increase. In recent days, we've started learning more about the variant. And one of those things we've learned is that it spreads very, very quickly. It spreads faster than any other COVID variant we've seen so far. It's doubling time. That's the number of days it takes, the number of infections take to double in the community. We estimate is between 2.5 to 3 days, which would mean at that rate, by the end of this month, we could hit about 1 million infections in the community throughout the UK. And we've always been clear that should the data change, and should it move in the wrong direction, and it looked like that the NHS might come under unsustainable pressure. Remember what that would mean. We wouldn't be able to get emergency care, not just for COVID, for a car accident or anything like that. We would act and implement Plan B.